Hi, I'm Dr. Trites with Doctor's Optimum Nutrition. The number one question I get from individuals is, what do you do? The 20-second version of this is, I help relieve pain and suffering. If you'll stick around for a few more minutes, I'll actually explain what I do and how I do it. So a little bit about my background. My experience is in pathology, and I'll explain that why it's relevant a little bit later. But working in the emergency room and then working my way towards orthopedics, I realized that the majority of patients that are coming into these two areas are in crisis care. They have an accident. They have a need for instantaneous help. But my mantra was not to work in crisis care. It's to work in conservative care. What can we do to get you from point A to point B, to keep you healthy, to prevent disease from happening, and to manage that case until we no longer can manage it. So that's why I went into the chiropractic world. How I work is I communicate with the body, mainly the nervous system. The nervous system responds to things of structure. We call that the big S. Bones, muscles, tendons, ligaments. It could be chemical, which would be, we'll call it hormones. It could be the organ system, how you digest, how you breathe, how your heart pumps. It could be what we call psyche stress, or the big P, which could be how stress is at work, how it is at home. Even the environment could be the stress, or the acupuncture system, which we call E. When we put those together, we get an acronym called my scope of practice. And we monitor how that nervous system communicates with the muscles, which is the movement and the function of your body. For instance, it's not just skeletal muscle moving up and down. I mean, your heart is a muscle, your digestive system is a muscle. When you get a headache or a migraine, or you have an allergy, those are all affecting how the muscle system works, and that's called a feedback loop. How do these two communicate? The point of entry that most doctors get is, hey doc, it hurts right here. That's called patient's priority. It's where we go and make an examination, find out, yeah, that's definitely what's going on. But the majority of it hurts right here becomes crisis care. If it hurts right there and you didn't know that you had an injury, that means that there was something else that caused it. And that's what we call doctor's priority, what we use in our office to go find out, how did that happen to get to that point, and what can we do to make sure that it doesn't come back? That's how we document. And then there is, doctor, I have headaches, it hurts here, I have a rash, in the morning I get dizzy, and I'm nauseous most of the day. Well, where do you start? So we ask the body, the nervous system, what's the most important thing, or the body's priority, and where do I start? So if you've come into our office, you've already filled out a pretty good source of paperwork, and I appreciate that you did that, and here's why. I have learned in about 30,000 visits that if I don't ask the why, or sometimes the how, at some point in our visit we have to make, or even our treatment, we have to make a shortcut and go reinvestigate what that is. Sometimes that costs more lab tests, sometimes that costs an extra visit, sometimes that costs more nutrition. So that's why you filled all this paperwork out. Now, when you come into the office, we not only ask questions about that, but then we give you an examination, a physical examination that is fairly standard and familiar to what you've had in a medical office and not necessarily a functional medicine or chiropractic office. And then we take it one step further, because in diagnostic procedures and handbooks of how we're taught to do these things in school, rarely does anybody do it. So that's why you get blood pressure on both sides of your body. That's why I hit you with my little reflex hammer in 12 different spots as opposed to 2. There's the things that we're supposed to do because it adds information. And then when we start your examination, what we call our electronic or central nervous system examination, I test 120 different nerve points within your body to find out, what did you really bring to me to the table, and what can we do to fix you? Now, we have a way to find out if you actually qualify for conservative care, or if perhaps I need to send you on somewhere else. That's the benefits. And we also look at other outside influences, such as where you work, what you eat, and influences such as genetics that help taper our treatment. So while we monitor the nervous system, how we fix you is we fix muscles. And I fix muscles based on 35 factors that affect muscle function, such as you could have blunt trauma, you could have inflammation, you could have swelling, you could have an underlying, let's say we'll call it diabetes, or a blood supply problem. Most of your doctors do evaluate muscles in some form or fashion. Most chiropractors use 3 to 5 of the 35 factors. Most physical therapists use 2 to 3, and most medical doctors use 1 to 2, mainly checking for ranges of motion and strength. as there too, but there are those other factors. So this is how you can go have an examination and say that everything's fine and you look fine, and then you've heard of people that have gone in for a routine stress test and had all their arteries clogged, or they went in for a test and had some pathology because they're not checking all of these factors. So even when you have injuries, even little ones, they add up over time. And that's my job, to make sure that every single time you walk in the office, I check for, and this is where my pathology came into play, any possible thing that I know what I can test for or evaluate, such as inflammation or then how the nervous system reacts or blood supply. As every pathology book says, this disease has inflammation and vascular swelling, and this disease has inflammation and vascular swelling, and what different ways can we test for those? And so we want to test each one of those, because I can tell if we're gaining, or if perhaps there was something that has happened in your lifestyle. Maybe all of a sudden you became allergic to a food such as wheat, that has changed how your outcome has become. Now, stepping back to that muscle work, how we fix the muscles. Muscle testing itself might have a name known as kinesiology, and it has kind of a, at least in the healthcare stigma, not necessarily a great understanding. And the reason is because most of the people that do muscle testing don't understand the nuances and the complexity of muscle testing. They just take a muscle and they test it. Well, I'm here to tell you that the muscle changes throughout the time of day. The muscle changes as our hormones go up and down. A muscle changes function with blood supply. A muscle will change function if I stand up or sit down, or I flex or I extend. I can change all the different postures and positions, and it changes muscle integrity. So unless you have a way to monitor the nervous system, or you want to go ahead and check a muscle 56 to 100 different ways, then this is how muscle testing can be missed, and why it's not exactly an exact science unless you're monitoring the nervous system. So how we term how we're monitoring the nervous system is really called bioelectric. There are devices that check bioelectric impedance of the nervous system. So we're monitoring the bioelectric system, which is you. This is not magic, it's electrical. Electrical is invisible. And if you don't believe me, you can put your finger in a light socket. Please don't do that. But you're bound to feel some electricity, and it won't feel good. So remember, I treat to relieve pain and suffering. I monitor the nervous system. I fix muscles. And the term is bioelectric. So truly, I'm a bioelectric master. I'm Dr. Trites with Doctor's Optimum. Be well.